When was the last time you actually talked to your partner about sex? Not just did it, but talked about it.
Welcome to the Spaghetti Wall podcast, where we dive into life.
Both the messy parts and the moments of joy, and everything in between. I'm Jason Wilcox, licensed clinical social worker.
And I'm Dr. Tansei Lee, a licensed clinical psychologist. Let's roll up our sleeves and get started. Okay, people, let's get ready to have a discussion about sex and intimacy within relationships. And let's be real, this is one of those topics that can be really difficult for people to talk about, but we all have thoughts about it.
We do, that is for sure. And if you're listening right now and already feeling a little uncomfortable, good. That means you're human. The thing is, people think they're alone in this, like their issues are rare, but they're not. They're actually super common.
Yeah, I think there's a lot of shame around it, embarrassment, sometimes guilt, and both individuals or all parties involved feel some type of way, but they're just unsure about how to talk about it. And when it does occur for them, they feel pretty alone and that it's something they can't really seek help or discuss because it's just taboo to talk about.
Some of the things that I talk about with people when we start talking about sex is I start normalizing the fact that not everybody has the same libido. And that makes it very complicated in relationships because either one person has a higher libido, one person has a lower libido, or even in the rare chances that both have the same kind of amount of libido, it doesn't always match up on when that's going to come up and their libido is going to match on when it's high. So that can create a lot of problems inside of a relationship.
Yeah, I feel like there's maybe a higher desire partner and a lower desire partner. Maybe you have the same level, but the anxiety around performance and engaging in intimacy or sex is wrapped around feeling reserved, feeling unsure. And I think the other component is just learning how to communicate about what feels good and what doesn't feel good with your partner is something I would like to highlight, that it is really about communication and trust and honesty.
Communication's a big part of it, but how to communicate is also another big part of it. Because if one sees the other as the responsible party to take care of their sexual needs and there's these expectations around it, that causes a lot of issues because then the other one might feel pressure, which starts impacting even their sexual desires and libido. It can impact the dynamics in the relationship and cause further problems with their sexual life.
When I was going through my doctorate program, I took a year-long sexual dysfunction course, and my professor, she was so good at just saying things like, it's not your responsibility to get your partner off. But just to bring it back, like, even if you don't have these extraneous barriers, sex is complicated.
One thing couples fall in a trap with sex is because they're so uncomfortable talking about it that they even become uncomfortable talking about it with each other. So they end up just trying to give signals and signs and giving implicit information to each other to try to hopefully have a sexual encounter with them. The problem with that is it can leave your partner set up for failure because they don't fully know what you want and it's complicated. So one thing that's really important is be explicit. So if you're in the mood and you would desire sex or desire those things, is to make sure that you make it clear that that's something that you really would like and request. Make sure that's invitational, not expectational, but you're asking and being blunt about it so the other person fully knows what you're looking for, what you would desire. And I know that sometimes when I talk to couples about this, they say, well, that doesn't feel romantic or sexy. And I try to show them that it's also not romantic or sexy when someone's giving the signs, but the other person's not picking it up, so they feel rejected, even though the other person didn't even know they wanted to have sex. So that doesn't work either. Sometimes I get, like I said, clients who say, oh, I don't like going up and explicitly saying, hey, I'd love to have some sex tonight. What do you think? And so another way around that is that you guys sit down and talk about the way to do that without saying it. So in other words, maybe you put a candle on the nightstand means, hey, I would love some sexy time tonight. But again, what you're doing is you're making it explicit because both of you know that's the way that it's being asked. That thing, whatever it is you come up with, is you saying, hey, I would love some sexual time tonight or today or whatever. So that's another possibly romantic way to do it.
Yeah, I think finding signals, because it is hard sometimes for people to just come out and say things like that. Like, even something that's not related to sex is, oh, when your energy is too overwhelming for me and I can't tell you, like, to stop talking, can I just say spam? So, with topics like sex, and if it's hard for you to say, I want sex, the candle on the nightstand is a great example of, like, we don't need to say it as long as we have set up the signal and communicated that and it's been agreed upon. And there's no right way to do it.
There's not a right way. There's a way of being sensitive to your partner, though. The way that you'd want to think about it is learn your partner. Sometimes what we do is we go into sex and intimacy, and all we know is what we experience. For example, many men tend to be more physical and visual when it comes to sex, while many women often need to feel emotionally connected and have life stressors off their plate before they feel sexual. The problem is, we often approach our partners the way we want to be approached. So a man might get physical right away, while a woman might seek connection first. And both can end up missing each other. But if you understand what really helps your partner get into that space, you can show up in a way that works for them. That might mean helping reduce stress or creating a sense of connection. Or on the other side, initiating physical touch or putting on something that sparks attraction. This isn't true for everyone, but the point is, if you don't know what makes your partner tick, you'll struggle to connect and you might even turn them off without realizing it. It's important to share what you do and don't like. And it's important that you inquire what your partner does and doesn't like.
Educating yourself on anatomy, I think that's really important too, to understand what you're born with. Pleasure and orgasm is very different for men and women. This is really interesting to just understand that people feel pleasure differently.
They do. Again, why it's so important to learn about your partner, explore, be curious, be creative, have fun. Always making it fun, never making it something that's a demand or mandatory or a force.
And I like to go back to your point, Jason, about, like, it is no one else's responsibility but ours to ensure that we are getting the pleasure we want. And communication with your partner is great. And I think we, as partners to our partners, it's important for us to be willing to explore the hiccups, to explore things that might be getting in the way, to explore psychological things, physical things, medical things within ourselves and our bodies, to know how to communicate those things, because our partners cannot read our mind. And so, yeah, I think just taking accountability and a responsibility to know these things about ourselves and communicate those.
Absolutely. I think there's another point I want to make sure we talk about is rejection. Oftentimes people tie sexualness, intercourse, and intimacy, they tie it very personal to themselves. So what ends up happening is they go in and they kind of allude they would like sex, or they bluntly ask, and the person that they're asking says, I'm not in the mood. And that immediately feels like this rejection of self, and it hurts and it feels bad. It's important to remember it's not a rejection. It's just the other person's not in that space. It's okay for them not to be in that space. They're not rejecting you. They're just not there at that moment. And so I try to help some of my clients try to think of it almost like a back massage or a shoulder massage, right? Sometimes this can help you step away and look at it a little differently. Is if you went and asked your partner, hey, could you give me a shoulder massage? And they said, oh, I don't have time right now. It wouldn't hurt so much. Think of it just like that. And at the same time, I take it one step further of, if you're not in the mood and your partner's saying, hey, would you mind? Or could we have some sexual pleasure time? If they're asking and you're not in the mood, if you have the time and energy, would you be willing to do something with them? Would you be willing to cuddle with them or put a hand in or a toy or something that allows you to still have an experience where you don't have to have intercourse necessarily, but you can have an intimate experience together that still pulls you together, still meets each other's kind of needs and desires.
Yeah, I think just coming from a personal experience, like I can openly say I'm pretty low libido, especially after having my son. And so I think after having a child, it was very obvious for me that my hormonal levels have shifted and my libido was much lower. So in my marriage, I know that I'm one of the partners that's going to say, I don't need to orgasm tonight. That's fine. I can take care of you, and that's okay. And so that kind of open communication is really important so that the pressure and the guessing is taken out of the other person's head. You just say what you need and say what you don't need and state what you're willing and capable to do. I've had many female clients report that there's a lot of times that they actually shy away from physical touch or quality time with their partners, their husbands, because I had one partner state that, like, when my husband asked to cuddle, I would usually reject it and not want that because in my mind, it leads to sex. Like, that's what he wants. And I had challenged her. I said, "How do you know that's what he wants?" And she was not able to answer. It was just like an assumption. And so I was able to help her see that that could be driving a wedge in her perception and miss opportunities to connect and have these attachment repair, especially after an argument or something. Another lady, she said kissing. Sometimes kissing leads to sex, and sometimes she avoids kissing her husband because that can turn him on and lead to sex. So it's so interesting with these individuals in our therapy session where I do ask them, like, how do you know, without asking? And I do give that example. Do you feel safe enough to say, I'm not wanting sex tonight, but what can I do for you? And to ask themselves, are there things you're willing to do to support your partner if they are wanting an orgasm and they're needing your support or wanting you to be present? Does that make sense?
Yeah, and I think it's important to talk to your partner. So if you really feel like that's what's happening, then ask. I did have a couple I was working with. The one partner told the other that they did experience that anytime there was affection, they immediately were aroused and in their mind, it meant it was going to go to sex. And so it's important to have that conversation because if that's how they're really experiencing it, it's important to discuss that as a couple and discuss, well, what are ways to meet each other's needs without having to cross boundaries? And I think boundaries around intimacy and sex is important, is that the fact that if someone's not wanting to do something, it's really important to respect that. It's really important to say, yeah, I hear you. I won't cross that boundary because it's okay to give affection to someone. It's okay that they get aroused around that. And it's also okay to not go any further past that. It's also okay to have a conversation of if you are aroused, maybe we could do something later. And it may or may not involve intercourse, but having those conversations, being open and meeting each other and trying to find ways to help each other with needs and dealing with it and finding a balanced way approach with boundaries, with communication, it's critical. Another thing I think is important to talk about is that intimacy, sexual relations don't have to equate orgasm. This was something really difficult for a lot of my couples to understand when I work with them, is they think, okay, if I'm going to go in to have, if my partner's wanting sex, but I don't want to orgasm, or I don't want the actual intercourse part, or I don't want to go the full way. I only want to do certain steps and allow them to go masturbate or take care of themselves. These are all important things to talk about too. Not everything has to be that there's an orgasm. And sometimes that's difficult for people to hear at first, but when you start understanding the fact that it's okay if one of you doesn't have an orgasm and the other one does. And on the flip side of that, it's also important to advocate for yourself. I normally hear this from women where they don't speak up when they're not getting orgasms and they want them. It's really important to communicate with your partner if you're not getting an orgasm and you want one and they're already done and ready to move on. It's important to say, hey, pause, stop. I still would like an orgasm. Can we finish things up here? Because I'm telling you, I've met lots of women that just be quiet. They don't have orgasms, but they want them and they're just afraid to talk to their partner about it. So it's important to talk about that too.
Yeah, and normally when that discussion comes up, Jason, for me and my female clients, I usually say, "Well, how do you have an orgasm on your own? Do you know how to give instructions to your partner to help you?" And some females can go all their life not having an orgasm because of this issue, and that's sad, right? It is something that you have to learn about in your body and be curious. In talking about orgasm, I think there's men who have either early ejaculation or, erectile dysfunction where they just have anxiety and they can't get it up, can't get it hard, or can't come to climax because of these issues. There's so much shame around that. So I think, I was reading the book called When Sex Isn't Good, and there are issues that come up medically where one or the other partner cannot orgasm or don't get to orgasm during this sexual intimacy time. And how do you talk about that? How do you make it so that you clearly express, I feel shame when this doesn't happen? Or the one partner goes, I feel unattractive when I can't get you hard. And usually the conversation is like, it's not you not being able to get me hard. It's not me not being attracted to you. And so these conversations get deeper and deeper as we look at each individual's perception of what it means when there's no orgasm.
Well, and I think you're again highlighting a point we talked about earlier that's really important. Taking sex and intercourse and that kind of intimacy level personal. It's important to not make it so personal as it is more of a connection. It's enjoyable. It's something that's definitely important in relationships. But at the same time, just understanding your partner is an individual that experiences life the way they experience life. It's different than you. So, like you said, with an erection, that's a good example where one might find their partner very attractive and want them very much, and they might arouse them a lot. But if there's an erectile dysfunction, it's not going to matter. So being careful not to take things personal, having open conversations, all important things to do.
Yeah, and seek medical advice from your doctors. I mean, there are medication that supports if you have ED. There's tests that you can run to see if there's hormonal imbalances or deficits or deficiencies. So please don't do this alone. Please, talk to your medical providers. Please seek support.
Mental health providers.
Yeah, mental, we are therapists. So
I've helped a lot of people. We've helped a lot of people with their sexual experience and relationships.
absolutely. I'm very proud of the fact that early on in my training, I learned that lots of therapists are not comfortable talking about sex. And so I said, That's not going to be me. I'm signing up for this course." And for a whole year, I talked about sex. So for me, therapy is about or introspection and questioning and being curious and learning more about yourself is not really about don't do. So, I hear you say, don't take it personal. And I think in order for us to get to that step, it's important to add the tool of can you check to see what about the sexual encounter have you made personal? So what is it that I am taking personal when my husband doesn't climax, or what am I taking personal when my wife can't get wet, cuz that's something that happens to female as they age. There's vaginal dryness, there's issue with lubrication. And so these are things that come up and we do take it personal. It's so hard for us not to take it personal. And so the question I would reframe it instead of saying, don't make it personal. I would say, in what ways are you making it personal?
Well,
S-
and I think if you're struggling in this area, again, this is where a therapist would be very helpful.
Yes. a therapist, and a medical provider.
I think it's really important going back to when you're exploring sex with your partner is knowing there's a lot of things that you can bring to the table, right? So sometimes you might be dry down there. So it's important to look at there are lubricants out there specifically for sex. It might be that just doing plain old Jane sex isn't quite meeting all the sexual needs. There's lots of toys out there that you can get and bring into your sexual life too that can be fun and enjoyable to help everybody get pleasure. Like, just realize there's more, if you don't know already, that you can make this experience a lot of fun for both of you and make it enjoyable.
Yeah, I agree with that. I think some people may not be as comfortable, but again, that's the conversation to be had. Like, what have we not explored yet? What are some resources out there? What is the internal judgment that I have about buying a toy or using a toy with my partner or on myself? And so I know there's a lot of people who have internal judgments that keep them from exploring and getting support. And I could tell you a funny story. I have older aunties, I would say, in our community. I remember one time one of my aunties was talking about sex and how sometimes it could be painful because the older you get, it's harder to become lubricated naturally. And I said, "There's lubrication, auntie." And she's like, "What do you mean?" I said, "There's lubrication for that." It was kind of like, "Oh, my hair's dry, use conditioner." And it is just as simple as that.
Well, sex can be as simple as that. The topic can be as simple as it can be just, hey, let's talk about this. But what happens and what Tan was noting earlier, it's very difficult to do this, but it's when we start wrapping all this, the sexual stuff, when we wrap it in and make it about us, when we make it personal, instead of enjoying the fact that this is just something you get to do in your relationship. It's something that's an activity that's very fun. But there's a lot of nuances and things to communicate to make it so it can be a very pleasurable part of the relationship. I think there's one other topic I can think of that'd be important to address is cheating. I'm not going to go too far into this except for the fact that it's very painful. This is something that's dishonest, right? That you are not communicating with your partner. That's the whole point of cheating, right? If you want to open a relationship, you need to talk about it. If you don't want to be with your partner anymore, then you need to talk about that. But cheating is something where you are breaking the trust of your partner because you have established boundaries. You've already agreed how you want your relationship, and now you are going in and having a sexual encounter with someone outside the relationship. And one piece in this that I think is important and critical that I work with couples who come see me where one of them have cheated on the other. There's a really important thing to recognize. If your partner cheated on you, it's not about you. Your brain might start going, oh man, am I pretty enough? What did I do to make him do this or her do this? What could I have done differently? Do I need to start acting a certain other way? No, you didn't do it. You didn't cause it. For someone to go cheat on their partner, that's something that's internal to the person that cheated. You didn't do it. Could there be things that you're doing that's making the relationship more difficult? Oh, sure, maybe. We all might have our human things, but that doesn't mean you caused someone to cheat on you.
I love that. I love that reminder. Yeah, we all are guilty of contributing something because it's a two-way street, right? There's always something to examine what's my 50%. And maybe it's not always 50%, but oftentimes people do blame themselves when their partners cheat. And I think it's a coping mechanism of like, oh, I can change something about me and prevent this from happening. And I think that's such a false
Yeah,
fallacy.
not going to happen.
It's such a delusional thought. It's an illusion. And if you're with someone who cheats on you or cheated on you and they blame you, that's a total red flag.
It's a lie.
Yeah, it's a
And if you're the one that in your mind, you truly believe you're cheating on your partner because of them, I can tell you right now, it is not because of them. It's something that's happening in you. It's something going on. And if you decide, hey, I don't want to cheat, I got in a really bad spot, I would so encourage you to go see a therapist about it, because I promise you what's happening is internal in you. It is not about your partner.
I just love that. It's not you causing it. And these are, I think, more serious situations where not just going to seek therapy for yourself, but having both individuals in individual therapy and then seeking a couples therapist would be really, really supportive and helpful if you're hoping to make amends and do the attachment repair.
So if there's one takeaway, it's this: sex and intimacy aren't about perfection. They're about communicating clearly what you want, not taking it personally when the answer is no, staying curious about your partner's likes and dislikes, and respecting boundaries. Keep talking, keep learning, and keep it fun. Thanks for listening to The Spaghetti Wall. If you found this session helpful, consider sharing it with someone who might need it. And don't forget to subscribe for more real conversations about mental health, happiness, and how we keep going even when life gets tangled. Until next time, keep showing up, stay curious, and remember, the mess is the method.